Welcome to the first in a series of conversations about cardiovascular health with Dr. Harvey White. Dr. White, it's good to have you, and I'm looking forward to this series with you.
You know, Larry, I'm very much looking forward to it as well, and thank you for having me here.
Little background on you. You were one of the founders of the Heart Hospital here in Albuquerque.
Yes, I was.
How long ago was that?
That was some 15 years ago, believe it or not.
Wow. Still looks new over there. And now, Vessel Health. It's a brand new practice. What's Vessel Health about?
You know, Larry, Vessel Health is both a practice and a business initiative. We decided, myself and some of people that work with me, that in spite of doing a great job repairing people's hearts and fixing them, the real emphasis should be on prevention and how to keep people out of trouble. And so we took a step back and looked at America, looked at health in America, and decided that we could make a real difference if we tried to limit or minimize, you might say, cardiovascular illness. So Vessel Health targets health promotion and the prevention of heart disease.
You want to get to people before they're in trouble.
We absolutely do.
Yeah, at Heart Hospital you saw them after they're in trouble, and certainly you did great work there, but this is a whole shift in thinking, isn't it?
It's a shift in thinking, and it also takes a whole shift in the way we communicate with people. And this series of talks we're going to have, or conversations, really is intended to try to communicate with individuals that are out there that might want to listen about their cardiovascular health and how they can affect it.
I mean, over the years you've seen a lot of patients who have had the heart attack or have had the heart disease issues, and they wish they had taken better care of themselves prior to. I'm sure there's not, that without exception, everybody says that.
They all say that, and it's interesting that afterwards they really take an interest in their health, and they start to exercise and they change their diets, at least for a while.
What gave you the passion to want to do this, to change this direction like this?
Well, you know, that's an excellent question. I spent a considerable amount of time in the domain of what we call interventional cardiology. It's the area of cardiology in which we fix heart arteries and fix carotid arteries by putting stents in and doing angioplasty and so forth and so on. And as I did that, I also taught a course. And as I taught that course, I noticed that I was adding more and more topics that had to do with how we live and how we can affect the course of cardiovascular disease, you might say. Mm-hmm. And so it's out of that experience that I think that this really was generated. But what we're going to try to do in the course of as many conversations as you and I would like to have, is we're going to try to cover a number of topics that might give a feel to those who want to listen, the audience, about how they can impact their cardiovascular health care over the long haul.
And I know, Dr. White, when you and I were first talking about Vessel Health, I said, who's your ideal patient? And you pointed right at me and said,
it's you.
Yeah, it's us baby boomer men and women, right?
That's absolutely correct.
We're in that critical time, and thankfully I haven't had any heart disease. So what I want to ask you is, if I come to you, what's the experience like? What am I going to go through with Vessel Health that's going to benefit me?
Well, actually, Larry, that's an excellent question. And what we're going to try to do over the course of 10, 12, 15 sessions together, or conversations, is a little bit lay out that experience.
Yeah.
And I'm going to try to build that upon different topics, you might say, that would be important not only to you, but to all Americans and all people in civil society, actually, areas that are important not only to understanding whether or not an individual has a budding heart health problem, but also how to impact that.
You can still have a life and still take care of your heart, right? You don't have to give up everything. And
you know, one thing that's going to come out over and over and over from me is that whatever we preach has to be doable.
Right.
If it's not doable, it doesn't get done. And one of my own opinions is that what we've done too much is that we've asked for excessive amounts of diet restriction or exercise from patients, and it becomes a simple target for not doing it. So what you're going to learn over time is some very simple, doable opportunities to improve your health.
If people want to contact you at Vessel Health, how do they do that?
That's 505-828-3000, or we have a website. That website is www.vesselnm.com.